The risk factors that may cause infertility can be many, and some of those include women who've had previous pelvic surgery. That may cause one to have pelvic adhesions and result in infertility. There are a number of other issues that may lead to infertility. So, for example, a woman who has irregular menstrual cycles. Having a period is not infertility, but having irregular menstrual cycles would imply that you're not ovulating regularly. So most women get about 12 periods a year, which means you're ovulating 12 times a year. If you ovulate anything less than that, then you're reducing your likelihood of getting pregnant. So women we would define as having less than 6 a year regular periods would be something of significance that they should raise to their physician. Body mass index, so an increase in weight. Even overweight women, not obese women, have an increased likelihood of infertility. I like to use the rules of 25. So if you have a body mass index, and we calculate body mass index based on your height and based on your weight, that if you're above 27, you have a 25% reduction in fertility. You also have a 25% reduction in fertility therapy. So attempts at losing weight prior to attempted conception will dramatically increase your likelihood of fertility and also the treatments related to fertility. Other things for women to think about that kind of go hand in hand with irregular menstrual cycles and increase in body mass index would be things like breast discharge that can be associated with those problems. Those are endocrine hormone problems that can lead to infertility and irregular menstrual cycles. Women that have abnormal hair growth, women that have excessive acne are associated with conditions called polycystic ovarian syndrome. PCOS, or polycystic ovarian syndrome, is associated with obesity, overweight, irregular menstrual cycles, and actually pre-diabetic and diabetic conditions, all of which can easily be treated and simply result in normal fertility once they're normalized. Other things that can be associated with fertility is that if you have a family history of recurrent pregnancy loss, there can be an association with uterine congenital defects that may result in fertility and recurrent pregnancy loss. And then lastly, your partner. Don't ever underestimate if they are excessive weight gain. They may have issues related to sperm function. Interestingly, issues related to ejaculation. If a man does not ejaculate out the tip of the penis, but rather on the top or on the bottom, which we refer to as hypo or epispadias, may result in infertility-related issues. So some simple things that may predispose or increase the risk